News tonight, 3 people overdosed on heroin in Plainfield in less than 24 hours. One of those overdoses deadly. State officials now have a new tool to track overdoses in their fight against the opioid crisis. And tonight we're learning how this new data is being used to save lives in our state. News 8's Bob Wilson spent some time looking at those numbers. He's live in Hartford tonight with the breakdown. Bob.
Yeah, it's the Epicenter Surveillance system, and it's used normally for bioterrorism. It's the state health department's way of monitoring that, but they found a way to monitor the opioid crisis through hospitalization. They have the hospitals report in, and they're tracking those hospitalizations across the state. Alarming numbers tonight, but it's a good sign that they can track these numbers.
What do I think about these increased numbers? They're scary, they're frightening. It makes me mad.
Connecticut now tracking opioid hospitalizations across the state, and the numbers are startling. In the first 2 months of 2018, there were more than 1,300 people hospitalized. Hear how the numbers break out statewide. And these are just the numbers for the top 5 counties that are leading the way. Dr. Craig Allen, medical director at Rushford, says the numbers, as ugly as they are, can be a huge tool in figuring out the opioid crisis.
Now with this tracking system, maybe we'll get an alert about some new powerful opioid that we can then look for with our patients and try to intervene before it's too late.
And another area where the numbers will really help out, juveniles, tracking teenagers or adolescents and exactly where the opioids are coming from. They said by able to track the visits to the hospital and finding out more about that, they can determine exactly what's going on in the home.
Once those opioids are in the home, they're available to that teenager or that teenager's friend or the kid down the street who happens to be over for an afternoon, and they're going through the medicine cabinets.
Dr. Bill Zemsky at the Connecticut Children's Medical Center says the numbers are good to have along with the stories behind them. When looking at kids, they're more susceptible because they're more experimental than adults. And the research shows parents need to be more responsible with the opioid prescriptions.
We got to keep those opioids either locked up or disposed of. When you're done with an opioid, get rid of it. It shouldn't be in your home any longer.
And both doctors say, a month-by-month total or tally of where the hospitalizations are, where the focus is for that month, can help them direct treatment and also law enforcement to look in that area to see exactly what's going on there that's different in the other parts of the state. I'm Bob Wilson reporting live in Hartford, News 8.